So today I'm going to be talking about a tick that I don't have. Well, and it is called echolalia. Echolalia is the involuntary repetition of words or phrases previously spoken by another person. Well, while it is a normal part of language in development in toddlers, typically resolving by the age of 3, its persistence beyond this age can indicate an underlying issue or a neurological condition. Types of echolalia. Immediate echolalia. This occurs when an individual repeats speech immediately after hearing it. For example, if asked, "How are you?" that person may respond, "How are you?" Delayed echolalia. This involves repeating words or phrases after a significant delay, which could be minutes, hours, days, or even longer. This might include repeating lines from TV shows, movies, or past conversations. Well, functional echolalia. Often, echolalia serves as a purpose. It can be a way for individuals to process language, self-regulate, express emotions, or even just practicing speech, or initiate social interactions, especially with those with autism. Unmitigated versus mitigated. Unmitigated echolalia is an exact repetition, while mitigated echolalia involves some alteration to the repeated speech. Internalized echolalia. Some neurodivergent individuals experience echolalia internally with sounds, songs, or phrases looping, well, dickhead in their minds. Causes and associated conditions. Neurological disorders. Echolalia is most commonly associated with autism spectrum disorder, with up to 75% of children with autism exhibiting echolalia. It can also be seen in Tourettes syndrome, well, ADHD, and other conditions. Neurological conditions like brain injuries, particularly affecting the language and processing areas, can lead to echolalia. It can also be present in conditions like aphasia, which is due to brain injury, dementia, and encephalitis. Stress and anxiety. Echolalia can be a coping mechanism and a response to stress and anxiety. Development stage. In young, typically developing children, echolalia is a natural part of language acquisition and learning. Well, the symptoms and diagnosis. The primary symptom is the rote repetition or the imitation of words and phrases. Diagnoses typically involves a review of the individual's history, observation of language skills, and sometimes standardized assessments by professionals like speech language pathologists. Treatment and management. Treatment varies on the underlying cause. The main goal is to prove effective communication. Well, speech therapy play a crucial role, using techniques like prompting and fading, scripting, language modeling, redirecting, rephrasing, and providing choices. They help individuals learn functional communication skills and reduce reliance on echolalic responses. Behavioral interventions. Applied behavior analysis can be used to understand the reason for echolalia and teach appropriate communication skills. Well, this includes strategies like cue pause point training, script training, and verbal modeling. Augmentative and alternative communication. Methods such as picture communication, symbols, and electronic devices can provide alternative means of communication. Parental and caregiver involvement. Education and training for parents and caregivers are vital to support communication and development at home. Well, reinforce therapy skills and provide a predictable and calm environment. Wow. Neurological and pharmacological approaches. For echolalia related to specific conditions like Tourette's syndrome, comprehensive behavioral intervention for tics may be used. In some cases, medication management might be considered, particularly for underlying neurological conditions. Many experts emphasize that echolalia should not be seen as a meaningless parroting, but as a meaningful step in language development for a functional communication tool, well, especially for neurodivergent individuals. Understanding the function behind the repetition is key to providing support and effective support. Now, if you believe or you think that you yourself or somebody else in your social like circle may have this echolalia, then please don't be afraid and go and seek medical advice and training.